East Barnet Veterinary Surgery. This is the practice that we used to bring our dog to when I was a boy. The practice was started in 1971 by Geoffrey Paradise. I joined the practice in '94. Jeff retired in 2008. In 2011 we moved here, number 1 Cat Hill. A good address for a vet, we thought. Let me show you around.
Barnet Surgery. Good morning.
We have 5 experienced receptionists in the practice, usually 2 working at any one time to make sure phone calls are answered quickly and to coordinate visits to the surgery.
Okay. Andrew, bye-bye.
We all like getting to know our clients as it means we can provide a more personal service. There are separate seating areas, so dogs and cats can be kept apart. This helps to reduce the stress of a visit to the surgery for the animals as well as their owners. We didn't want the practice to look like a hospital waiting room, hence the fish tanks and the chameleons. The nurses have banned me from having any more tanks, even though I look after them myself, usually. When an animal comes in for treatment, the consulting room is where we examine the patient and, in partnership with the owner, agree on the best solution for the pet and the owner. As well as being experienced veterinary practitioners and surgeons, we all have our own specific veterinary interests. Sam, for instance, is interested in consulting and preventative care.
Oh, don't be silly. It's nice to see her brighter.
It is, yeah.
Annette has further qualifications in physiotherapy. That's really helpful in post-operative care after orthopaedic surgery or for those patients with arthritis. Rachel is our exotics vet. She has extensive experience with all kinds of species. It's not unusual to see a capybara or a meerkat on Rachel's waiting list. This strange-looking animal is a raccoon dog. My personal interests include soft tissue surgery, especially ears and wound management.
Get his first vaccination started today.
Murray is our orthopaedic vet. He's usually in charge of fracture repairs and ligament surgery. Murray and I were at college together, and we've worked together since 2000. Our fully stocked pharmacy and efficient dispensing system keeps most of the drugs required in stock. Others are delivered within 24 hours. Murray originally qualified as a pharmacist before becoming a vet, so he's the go-to guy for expert support in this department. The prep room is the hub of the practice. It's where your pets go when they need further investigation, treatment or surgery. It's also where we induce anaesthesia in those patients that are going to have surgery or a medical procedure. What you see now is an example of an anaesthetic induction. The patient has already had a pre-med and so is relaxed and calm. The digital endoscopy facilities at the practice let us look into the stomach or into the noses of our patients. However, it's most frequently used for removing chewed socks and toys swallowed by naughty dogs. Murray does most of the ultrasound investigations, a technique which allows us to examine the internal organs. Diagnostic ultrasound is especially useful for assessment of heart disease and abdominal conditions such as liver disease. Our digital X-ray suite is the basis of many diagnostic workups. We're able to get images from all shapes and sizes of pets, from tiny geckos to Great Danes, and for all sorts of conditions. The on-site facilities mean that we can get started with appropriate treatment straight away. Our qualified nurses all have extensive experience in caring for pets and in carrying out minor procedures. Most pets will require dental work at some time in their lives, even if it's only a scale and polish, to help keep the teeth in great condition. The nurses also run a dental clinic, and we encourage owners to come along for help and advice with pet oral hygiene. Our caring nurses are responsible for day-to-day management of our inpatients. They give hospitalised pets the best treatment, including cuddling them if necessary.
I need to do more on actually setting.
East Barnet Veterinary Surgery is also a nurse training centre, so we usually have 1 or 2 nurses on placement while studying for their nursing degree. Julia and Charlie are responsible for providing guidance and support to the trainee nurses whilst they complete their portfolio. Here in the cat ward, we provide a quiet, secure area for our feline patients to recover. It's separate from the dog ward to minimise stress to our hospitalised cats. Extensive notes are kept for each patient. Regular checks are made to make sure that treatments are taking effect. Cats especially often need encouragement to eat when they're unwell. Many require intravenous fluids. The dog ward, as you can hear, is usually noisier than the cat ward. The stainless steel kennels are secure and allow for thorough cleaning between patients. The dog ward leads out into a secure exercise area so that our canine patients can stretch their legs. The garden provides us with an outside waiting area for unsociable or nervous dogs or anyone wanting to relax while they're waiting for their pet to be treated. The aviary with canaries and quails and the pond with terrapins also provide interest, especially for children. Some patients have very specific dietary requirements, so our food prep area stocks a wide variety of foodstuffs, from bloodworms, mealworms, locusts, vegetables and hay, to conventional cat and dog food, and even chicken breast and tinned sardines for our more refined patients. This is our reptile room. We have several specialised vivariums with UV lighting, heat pads and thermostats to look after these fascinating creatures. Should your pet require surgery, you can be confident that the procedures that we follow are very similar to that which NHS doctors and nurses follow when treating humans. We do everything we can to minimise the risk, and that begins with keeping everything as clean as possible. The scrub sink is the last stop before theatre, where the surgeons scrub up in preparation for surgery.
Right, I'm ready to go through now. I'm going up.
Our nurses are responsible for maintaining and monitoring anaesthetised patients during surgery. The patient is draped with just the surgical site exposed. We're able to carry out a wide range of surgical treatments here, from neutering to life-saving emergency surgery. Just like in an NHS theatre, while the patient is asleep, their breathing, heart rate and rhythm, oxygen saturation and temperature are monitored and recorded. Once surgery is over, post-op care is vitally important, especially providing adequate pain relief. A physical examination won't always provide a diagnosis with a complex problem, so we sometimes need to analyse blood or other samples. The in-house lab at East Barnet Vets is fully equipped for rapid testing and same-day results in many cases. This lets us start treatment promptly. Our lab machines test the blood for conditions such as kidney disease and anemia. Our microscope has a variety of uses, like checking samples for parasites. The screen is useful when we're teaching. We have lots of vet students and school pupils visiting during the year. Our puppy and kitten packs get new pets off to the best start, while our healthcare plan provides all the health checks, worm and parasite treatments that your pet needs. We even send text and email reminders to keep you on track. The surgery hosts a weekly puppy training class run by our dog trainer, Terry. The course covers basic training and is lots of fun for pets and their owners, and is very noisy. The classes give puppies a positive introduction to the surgery. All the graduates rush in to see the vet for their appointments, even for vaccinations. As you've seen, there's a lot more to East Barnet Veterinary Surgery than meets the eye. It takes an extensive range of specialised equipment to provide 24-hour care for your pets. But most importantly, we've got a friendly, dedicated and professional team who will get to know you so that they can provide a personalised service and excellent support in caring for your pets.